Today we are going to talk about what to expect after your transplant, specifically your transplant clinic visits. It's important to understand the frequency of these visits and the support you'll need to ensure a successful recovery. After your transplant, and once you're discharged home, you'll be coming back and forth to our clinic very frequently. These visits will decrease over time, and you will also have frequent blood draws, heart-specific testing, including biopsies and heart catheterizations, as well as daily logs to complete. It's crucial to remember that during this time, you won't be able to drive a car. So it's essential to arrange for a support person or even a team of people who can assist you in getting to and from these appointments safely. Having a caregiver support during your recovery period is incredibly helpful. They can gently remind you to take your medications, plan appointments, and be a source of comfort. Your caregiver can also help monitor any symptoms you may be experiencing. And sometimes you may not even realize certain symptoms should be reported to the transplant program. So having someone who can communicate any concerns or changes in your condition is highly valuable. You will be given instructions on who and when to call if this should happen. Now let's talk about why we see you so frequently during the initial stages of your recovery. We're closely monitoring for something called rejection, and rejection can occur when your immune system recognizes the transplanted organ as foreign and attempts to attack it. Our medications are specifically designed to prevent this from happening. Rejection is likely to occur during those early stages of transplant, but can happen at any time. So to ensure your well-being, we'll need to monitor your progress regularly, even if you don't experience any symptoms. Should rejection occur, don't worry. In most cases, it's treatable. Our transplant team will discuss your treatment options, and depending on the situation, you may need to come into the hospital for additional medications. This is to help regain control over your immune system. Now let's talk about your long-term care. The medications we are giving you are known as immunosuppressants, or anti-rejection medications, and these are lifelong companions, accompanying you through your transplant journey. You'll need to take them twice a day, 12 hours apart, and our goal is to strike a balance, ensuring there's enough medication in your system to prevent rejection whilst not suppressing your immune system too much. Immunosuppressant medications can reduce your body's ability to fight infections and slightly increase the risk of certain cancers. But however, there are steps you can take to minimize infection risks. First and foremost, washing your hands is critical, and you've heard that throughout your life. Hand sanitizers are a great thing to have on hand. Carry them in your pocket, purse, or even your car's glove box. They provide a convenient option for keeping your hands germ-free. Avoiding people who are sick is equally important. If you know someone has the flu or other sickness, it's best to avoid close contact. During your first month after transplant, we will ask you to wear a mask when visiting the hospital or any other germ-prone environments. This measure helps minimize the risk of the infection spread. Your care team will let you know when you can resume going into the public, but always exercise caution. Wiping surfaces with sanitizing wipes, especially when handling items such as shopping carts, can reduce germ exposure. And when attending large gatherings or even events, it's advisable to avoid individuals who appear unwell. Our ultimate goal is so that you can regain a productive life after your transplant. We're here to support you in achieving that. So whether it's traveling, spending time with your grandchildren, or even returning to work, we want you to embrace the freedom that comes with renewed health. We understand that your journey ahead may feel overwhelming, but you're not alone. Our dedicated transplant team will be with you every step of the way. So remember, attend your scheduled clinic appointments, follow your medication regimen, and stay vigilant about infection prevention. Together, we can ensure a successful and thriving life after transplant.